Hey, everybody, and welcome to the Dr. Mom Show. It is Dr. D, mom of three. Thank you so much for joining us today. I hope you're having a fantastic and safe day today. For those of you joining on the Dr. Mom Show podcast, this is episode 9. Woo woo! We're almost at double digits. That's going to be next week. And again, if you've missed any previous episodes, please make sure you go back. You don't want to miss this awesome information that we're giving out to help you learn more about medicine and just some life hacks and how to survive and live a healthier and happier life. But before we get into today's show, please remember that the Dr. Mom Show is a medical informational resource. It does not take the place of your physician or your child's physician. So please seek your family's diagnoses and treatment from your own physician. Well, today I am so excited because I have such a special guest on with me. She's special in multiple ways. She's not only an amazing, awesome, and strong individual, but I have the pleasure of knowing her personally, so I can personally vouch for her, how awesome and amazing and strong she is. So today I would love you guys to help me welcome Heather Overstreet. Woo! Hey, Heather.
Hello.
How are you doing today?
I'm wonderful. Thank you so much for asking me to be your guest today. I feel so honored.
Oh, well, it's my privilege, truly, truly my privilege. Well, let me tell you a little bit about Heather. She is an executive assistant for the CEO and COO of an agricultural lending company. So any farmers out there, or anybody helping us with our food, definitely you can hook up with Heather, and she can hopefully get you some loans, because we always need food. You know, I always said God made food because we need food. But the biggest thing also is that Heather is a breast cancer survivor. Yay, Heather! But she is also a beautiful wife to a fantastic husband who I also have the honor of knowing, and he's so great. And of course, this is the Dr. Mom Show. She is the mother of two beautiful, wonderful, funny girls who are too adorable. Love them, love them, love them. So today we invited Heather to be on the show because if you do not know, October is Breast Cancer Awareness Month. And I thought, what better way to, one, share information about breast cancer awareness, but to have somebody who's been through breast cancer, and not only been through it, but has survived breast cancer. So that, one, if you're somebody who is just starting off the screening process, or if you're somebody who is currently a breast cancer patient, or even another survivor, I just feel it's so applicable in so many ways. So again, Heather, thank you so much, because I just feel this topic is so important. And I don't know why, again, this isn't anything that's evidence-based, but I feel, the number of breast cancer has gone up. And I personally just think part of it is, what's put in food, things that are artificial. I was born in Guyana, South America, and in most third world countries, even though they're third world and they're poorer countries, when you go to the market, your food's still alive. Yes. Your fish is like jumping up and down. Yes. Your chicken, I remember my family like killing the chicken that day and like plucking off the feathers and stuff to cook it. And, I was younger when we migrated to the United States, but I just feel that the number of cancer in that country wasn't as high. And again, this is just something that I'm throwing out there, that I don't necessarily think this is something evidence-based at this point, at least not from what I've read. But I just feel we eat so much processed things. That there's just a higher risk of cancer in general. So, that's just my plug in for just cleaner eating, and just to plug in for what Heather does. I think that's why it's so important to support our farmers and people who are doing agricultural things. And technology has just offered so much to people who grow foods for us. Now we got organic stuff. They have this like hydroponic, whatever it's called. I probably said that all wrong. It's like agriculture that you can do in your own home. I mean, it's so great, but of course it costs money. So that's why it is so important to give back to our farmers and people who do help produce food and are, you know, I don't even know what it's called. The places that have like our cows and sheep. I mean, do you know what that's called? The people who do that?
No.
Yeah. We're like, okay, well, thank you for everybody, all the farmers. Shout out to all the farmers and all the people who are raising our poultry, like cows and sheep, and you're keeping the process clean. We appreciate that so much. So Heather, I would love you to tell the audience just a little bit more about yourself.
Okay. Well, I am born and raised in Statesboro, Georgia,
Statesboro,
which is a tiny little town in southeast Georgia. Born and raised here, went to Georgia Southern, got my BBA in marketing, and while attending Georgia Southern, I met my husband, who was also a Georgia Southern alumni, and we got married and moved off to Atlanta, Georgia, and did that for a few years before we got tired of the traffic and decided to come back home to be closer to family. God's blessed us with two beautiful children. Claire is now 8 and Lily is now 5, so second grade and kindergarten. And being through quarantine with them was, I think, harder than cancer.
Because if you guys knew these girls, man, they're a trip. They are a trip. Lily's more a trip than Claire, I feel like.
Yes, Lily tests me every day. She keeps me on my knees praying, but they are.
I guess there's always one who does that, right?
Yes. But so we just, we're just the typical normal born family. Two hardworking parents trying to raise two strong-willed children.
Oh, well, they are. You guys are truly a special family. And for those of you who don't know, my family and I lived in Statesboro before we moved to St. Louis. And just before we started the interview, I was sharing with Heather that I think, Statesboro is always going to be just a soft spot in our hearts, someplace that I think we'll always go back to. I don't ever feel we're going to lose our ties there, because if you want to live in a small town, it's a college town. It's not like super duper small. The population with the college is about 75,000.
Yes.
So not super small. So it's almost, for you guys who live out here, now that I'm in St. Louis, if you're in like a town like Columbia with Mizzou, they're about the same size. So not too horrible. And you're close to Savannah. Savannah's right there. You're closer to the beach. So it's a nice area that you can get to different places. But it is just a quaint place, and the people are so wonderful. And yeah, they're definitely a testimony to, just that southern hospitality. So, and we loved it. But again, yes, Heather, thank you. So before we get into like the real meat of the interview with Heather, I just wanted to share with you, of course, I got to share my statistics and like all that stuff. So again, I just wanted to let you know that the reason I feel this information is so important is because breast cancer is the second most frequently diagnosed cancer in the world. And that's pretty crazy. So lung cancer, just so you know, is number 1. Mm-hmm. That's a whole nother show. But breast cancer is also the leading cause of death in women across the world. So this isn't like the United States. This is that breast cancer is the leading cause of cancer death. So if you don't know, heart disease is the number 1 cause of death in women, but breast cancer is a leading cause for cancer. If a woman dies from cancer, it's breast cancer. And now in the United States, breast cancer is the most common female cancer that we see. And again, in the United States, it's the second most common cause of cancer death, again, with heart disease being the number 1. So you can see that breast cancer affects a lot of women's lives, and in turn affects their families, their spouses, their children, their, extended family, their parents. So, this is something that's so important. So I just want to let you know, if you know somebody who has breast cancer, if you know somebody with a family member, please share the video, please share the podcast, because I think Heather's story is just going to speak so much volume to you and just to be an encouragement, because anybody, whether it's breast cancer or any other type of cancer, it's hard. It's hard to go through something like that. Any disease process, it's difficult to go through, but cancer is one of those things that I'm sure Heather will share as she went through her treatment. You know, that just impacts an individual, their mental health, their physical health, their emotional health, but in addition to their family. And especially when you have children, that's hard. I mean, when I think of it, I've never been through it, but when I think of it, I can't even imagine. I just can't be in that position. So Heather, can you share with us, how did you find out that you had breast cancer, and what were there any signs or anything that caused you to think you had breast cancer and needed to get checked out?
Well, it all started in February of 2018. My sister, who is 6.5 years older than me, has extreme breast density. She has dense breast tissue. And so she gets monitored more closely than, I guess, a normal average woman. But I was 38 at the time in 2018, and I went to get in the shower one night. And while I was in the shower, I discovered the lump in my left breast. And so at first I thought, well, that's kind of not been there before, but I hadn't had any other symptoms. No, you read online about all of the, if you have this, or this, go see your doctor. I didn't have any of that, just the lump. So of course I thought, oh, it's nothing. It's no big deal. At the time, my children were 5 and 2. I also nursed both of my children, so I thought maybe it's just a milk duct that's, formed or backed up, or
Yeah.
that's very good medical terminology.
Oh, that's all right.
But because of my sister's history, I decided it would be best to go get it looked at. And so that's where I reached out to Dr. D. And she discovered it also. She confirmed that the lump was there. And so that's when I went to have my mammogram done. That came back, yes, you do have something there. You need to go have a biopsy, which then led to the biopsy, which then led to, yes, this is malignant. And that led to me going to see a breast surgeon, who actually was a blessing, because he discovered a lump, my camera's backward, in my left side, of my collarbone. And so he said, I'm not doing any treatment on you until we find out what that is.
Yeah.
So I had my first PET scan, and that's when it came back that I was diagnosed stage 3, B, breast cancer in my breast, my left breast, in my collarbone, behind my chest wall, and under my arm. It had already moved to my lymph nodes. And I remember sitting in the oncologist office, dumbfounded, 38, with a 5-year-old and a 2-year-old, stage 3. I mean, I've thought, oh, maybe stage 1. Stage 3, there was only 4 stages. And I remember looking at him and saying, are you telling me I need to call my attorney and get my affairs in order? Like, do I need to do my last will and testament? I mean, is this? And he said, no, no, no. And of course, I left there that day, and I was dumbfounded. I was just in shock. I prayed a lot with my husband and my mother and my sister. And I said, I have to tell my girls. My mother didn't agree with me. She thought it was too much for a 5-year-old and a 2-year-old to understand. But I knew that I had to be honest with them, because I knew the road ahead was going to be hard. I was going to be sick. They told me I was going to lose my hair. You know, I didn't want them to be scared. So we sat down as a family one night and I told them, I said, you know, I have a boo-boo in my boobie. And, you know, they asked all kinds of questions. How did it get there? Can it, you know, what's wrong? What does that mean? And I said, I don't know why it's there, but God knows why it's there. And God's going to take care of us. And Mama's going to have bad days and Mama's going to have good days. And we're going to get through this and we're just going to pray. And, you know, as I started my treatment, so that was February. I got my official diagnosis in March of 2018. They immediately scheduled me to have my port placed. And then I immediately started chemotherapy in April. I had 6 rounds of chemo. I had 17 rounds of infusions because I was diagnosed HER2 positive, which meant I was ER/PR negative, which also meant that my cancer didn't feed off of hormones. It was its own aggressive form, so it fed off of itself, and it was extremely aggressive, which is why it was already in the collarbone, the chest wall, and gone to my lymph nodes. So I immediately started the 6 rounds of chemo. I had 17 infusions of specialized drugs for the HER2 positive, 30 rounds of radiation, 3 surgeries. The surgery to put the port in, the actual removing of the breast tissue lump. I did not have a mastectomy. My physician felt like it was safe, that we could just remove the lymph nodes, remove the tissue bed, and then I had the surgery to take the port out. It was a long road. It was a long road, but you know, God was faithful. I had an extreme support system, a great church family, great friends, and I just prayed the whole time. I didn't Google. I didn't Google anything, which is not like me. Because
Which is
normally
good. That was
I'm the
good.
one that's going to Google everything to see what HER2 positive meant. What does that mean?
Yeah.
I
Yeah.
didn't Google anything. I couldn't. I only had to focus on, I've got to get through this for my children.
Yes. Yeah. And thank you so much, Heather. That was, I'm sure if you're listening, that was so much information that she shared. I have so much that I just want to ask you just from what you said. So one, I wanted to backtrack. So Heather brought up that, you know, her sister has had dense breasts, and some women have more dense breasts, and medically we call it like fibrocystic breasts. Some people, we call it lumpy bumpy breasts too. And a lot of times you can even feel lumpy bumpy breasts around your period, because when your hormone levels change, women who consume a lot of caffeine,
Yes,
can have those lumpy bumpy breasts or fibrocystic changes. And women who have more dense breasts, it's always harder to feel or even see a mass that's there, because they have so much dense tissue that you really have to do special imaging. Some of them will get ultrasound, some of them will get like 3D mammograms just to get better views. And I will say, Heather was very young when she was diagnosed, because do you have a family history of breast cancer? No, right?
no, I mean, my sister just has
the dense breast. So you might be asking yourself, since her sister had the dense breast, how come Heather, didn't get mammograms before? And the reason is, normally we don't recommend, if there's no family history, we don't recommend screening mammograms until the age of 40, essentially. So Heather didn't have a reason to get her mammograms prior, to the age of 40. So she was 38. Of course, if you have a family history, and what we consider family history is immediate, so that's a sibling or a mom, or if you have an extensive history where it's multiple generations have had breast cancer, then we either start at 35 or 10 years prior to the earliest diagnosis. So if somebody got diagnosed, so for example, Heather was 38, So her daughters should start having their mammograms at 28. So they would need it 10 years prior to when Heather was diagnosed. So that's number one. So that's why it's so important to get those screening mammograms on time. And Heather didn't miss it. She wasn't being a bad patient or anything. She didn't miss it. She was just like one of the few people who, I mean, she was like a random, case with no family history. Now, the other thing I did want to ask you, you said you found it in the shower. Do you normally, were you doing a breast exam or were you just kind of soaping up and you felt it?
No, everybody preaches about do your breast exams. No, I wasn't. I just kind of relied on my OB.
Yeah.
To do that.
And that's okay. I mean, there's so many studies out there that is kind of like up in the air if women should do breast exams, if it does help, if it does increase. But it's funny you mentioned that because women who have come to me and the studies do show that a lot of women will find an abnormality themselves, that even though you get, a physical breast exam at the doctor's, the chances of you finding something on your own is usually higher. And it's ironic you say that because whoever I've had who have found it, it's either their arm has brushed against their breast or something, and that's how they felt it. They weren't doing any formal breast exam.
Right.
So that's something also to keep in mind, that when you're just even moving around, if you feel something different or abnormal, and go to your doctor. Heather did, and you know what, Heather, I'll never forget that day. I'll never forget. I remember what room you were in. I mean, I remember everything like it was like yesterday. But go to your doctor, because we won't say like, oh, nothing's wrong. Even if we don't feel something, the fact that you felt something and you feel it's different from your normal, we would still get imaging. So don't think that, oh, I'm making this up, or, this isn't like, this is all in my head. Definitely checked it out. Get it checked out. The other thing I wanted to add was, Heather brought up that she already had lymph nodes. So medically we say that it's metastasized, so it had spread. And she talked about the type of cancer she had, the stage 3. So that's based on how extensive the cancer is, how far it's spread. So definitely these are just all important things that if you are diagnosed with cancer, that you do want to know what stage you are, because all of that affects how you're treated too. And then just to backtrack a little, sometimes, Heather mentioned she didn't have any symptoms. She just found the mass. But if you're having one like red flag symptom is if you're having any like nipple discharge. So let's say you're not breastfeeding or anything, but if you have like pus or blood that's coming out of the nipple, some women, if a lesion gets so big, it'll start pulling the skin. So we call it dimpling of the skin, or medically it's a French term. It's called peau d'orange. So it's like skin of an orange. Didn't know I spoke French, eh? But you know how an orange skin kind of dimples, has those little dimpling. What'll happen is a woman's breast will start having those little dimples because the mass is almost like sucking in, quote unquote, on the skin, causing that dimpling to occur. So if you notice anything like that, definitely get it checked out. And the thing that's scary about cancer in general is, unfortunately, until it's found, and if you don't have any signs or symptoms, you never know if there has been spread or not. And that's why we get the PET scan, because the PET scan will light up any cancer spread that there is. So these are all just very, very important things to know and just keep an eye on.
Yes.
So Heather, I can't imagine, at the time you mentioned when you got your diagnosis, I love the fact that you rely on God. I know you're a Christian. For those out there who don't know, I'm a Christian. I'm a firm believer in God, and he's able to, and God has everything planned out. God knew what the reason was that you got breast cancer. We never ask for anything horrible in our lives, but God somehow, no matter what it is, has everything planned out. And I know for you, Heather, I just want to say, I know God's going to use your life in such a tremendous way. Your story, your testimony of just what you've been through, I know is going to impact thousands of women's lives and families' lives as you go through. And that's why I'm so grateful for you sharing your story, because I think some people go through things and they don't share their story, and then they miss out on, impacting and encouraging and empowering other women. So again, I just want to say thank you.
Oh, thank you. Thank you.
So since your diagnosis, so you got the diagnosis, how has it changed your life at all?
Yes. Before I hate to say, not necessarily, I was always, I can do that tomorrow kind of person. Oh, we can plan that vacation next year. Oh, we can do this next week. And now I look at it and I say, we may not have tomorrow.
Yeah.
Um, if we are able to go on a trip or, you know, have the picnic in the park kind of thing, why not? Let's seize the day kind of thing.
Yes.
Let's do it now. Let's live now, not, well, when I get enough money or when we have enough time time off built up, let's then do this. No, let's do now. And then also, I had to teach my girls that, don't judge everybody by the way that they look. I shaved my head. I allowed my children to shave my head.
I'm sure they had a blast
They
doing
had
it.
a blast.
Because didn't Claire, who cut their hair?
Lily cut her own hair.
Okay,
Yes, I had to tell them. Now, Mama's shaving her head. This doesn't mean you get to go shave it. But yeah, so I mean, I made it. I tried to make it as light and fun
Yes.
as possible because I didn't want them to be scared, but also because I was bald, I had to wear wigs and hats and scarves and so then that brought up a whole topic of, if you see someone out in public that doesn't look like you, if they have, don't judge them because you don't know what they're going through.
So true.
If it just brought up a whole gamut of conversations that I never thought that I would have with my 5-year-old and 2-year-old at the time. And I also wanted to teach my girls and my 2 nieces and my 2 nephews that beauty is not always on the outside. I mean, how hard is it for a woman? I wasn't even 40, and it was already hard enough getting to 40 and dealing with all of that. But here on top of that, I felt like I was stripped of everything. You lose your hair, you lose your eyebrows, you lose your eyelashes. The one good thing about it was I didn't have to shave my legs. So, that was nice. And you have to go to when I was on radiation, I had to lay on, in a sterile, cold room, completely exposed with male technicians. And all any kind of modesty kind of went out the window.
Yeah.
And I had to teach my girls that beauty is not always on the outside. It's what we have on the inside to shine through. And don't judge a book by its cover because not everybody's going to look the same. You don't know what journey they're going through. You don't know what struggles they're going through. So.
And I think you hit on so many important things. One, I just wanted to say it's so awesome that you communicated with your girls. I feel it's so important, anybody out there, if you're watching or listening, whatever you're going through, whether it's cancer, any other disease process, I think it is important to share it with your kids because yes, you prefer that when something happens, it's not a surprise because that's going to scare them even more.
Right.
Versus being honest, putting it on the table, saying this is what's going on. And I think they would appreciate that honesty more than anything else. And I also just love how you put in there at the same time, not judging and being kind and and doing acts of kindness. And I feel that is so important because you're right. We never know what journey people are going on. We never know what people are going through. We don't know why people are having a bad day or a bad month. We never know. So that's why it's really important that we always, have a smile on our face. And, if you haven't heard me say it before, I always say you never know what your smile or what your even small act of kindness, like saying thank you or you're welcome or holding the door or giving somebody a small compliment, like I love your top, I love your shoes, how it can change somebody's perspective. You never know who is out there who is planning on, hurting themselves because nobody has said anything nice to them, or they feel so inadequate in this world that those little things can make a difference. So I love that, Heather, that you took the opportunity to also impart that into your little girls too. And I think especially for girls, it's so important in society, especially with social media. I think it's really hard for young girls to be who they are and have a good self-esteem because there's all this airbrushing. There's all this stuff where, it's not real, it's not real. And, I think a lot of young people live in a world where it's unrealistic expectations that are put on them because of social media. So I love that just from such a young age, you've imparted into them that, hey, like, it's okay if your head's shaved and you're going through this, and because you're still beautiful. Heather's beautiful. I mean, Heather's beautiful. Woo, woo, woo. I mean, you see Heather right now. She's gorgeous. And hair is a lot. I mean, one, I just want to say a woman's breast, if you're a man listening, I still just feel like a woman's breast is something, that's like ours, and it's a part of us, and it's a makeup. Like the patients who I've had who've had to have a mastectomy, I mean, it's very traumatic experience because that's part of you, that's part of your body. It's equivalent to women as if you're losing an arm or something because it's part of us. And even more so your hair, because when you change, like if you go on one of these apps where you can pose your picture and do different hairstyles, it's so funny what hair does to you. So hair really contributes to your look and how you feel. I mean, there's studies out there that, if you comb your hair and do it and like put a little makeup on, like how your self-esteem goes from down here to up here. So hair is also something that's just so like not necessarily important, but something that plays a big role in our self-esteem and how we feel, whether we feel up or happy versus like down. So I really love the fact that you were positive and you made it light instead of saying like, oh, now I have to shave my head because, because of this, and to give it negativity. So I love that you did that. I really, really, truly do. So that was awesome.
Thank you.
So at the time of your diagnosis, so looking back, would there have been anything that you would have changed at that time? Do you feel like if you're like, oh, if I knew this or if I did that, that would have changed anything? Or you're like, I was just gung-ho moving forward?
I don't think so. I continued to work as much as I could.
Yeah.
I had a great support staff at work that allowed me the time off that I needed,
That's awesome.
but I had to keep my head in the game.
Yeah.
I think we are blessed to have wonderful physicians and drugs and surgeries and all the technology that we have now to treat the cancer. But I really believe that it's all mind over matter.
Yeah. So
Um,
true.
and so I pushed forward. I didn't, when I was sick, I stayed home. But when I felt good, we went out, we went to work, we went to church, we carried on. I tried to carry on as much as normal as possible because when I was homesick, that's when your mind starts to play with you that you're not going to get better. This is it. You're not going to see your children grown. You're not going to see your children get married. You know, your husband's going to have to raise your girls all by himself. And that's where I had to say, no, I am not giving in to the negativity that, yes, I am going to make this. Yes, I am going to kick this in the butt. And yes, I am going to be a survivor. And
That's right.
I think that helped me stay out of depression that a lot
Yes.
of women go through, not just women, but a lot of cancer patients go
Yes.
through. Because I treated going to treatment day, I had to go to the, they called it the party room. Um, but the first time I walked in, there were patients in there that looked already defeated,
Oh,
and it broke my heart. I got up every treatment day. I knew I was going to be sitting in a chemo chair for 6, 7 hours, but I got up. I did my hair. I did my makeup.
that's right.
I put my lipstick on. I had my iPad with me with my favorite TV shows. And I honestly looked at treatment day as a vacation because having two small children, you normally watch Paw Patrol and
I know.
Mickey Mouse
Yeah,
Clubhouse all the
yeah,
time.
yeah, so
And
true.
so I used those 6, 7, 8 hours of watching my TV shows.
It was Heather time.
It was my time. And so I became really good friends with the chemo nurses. I laughed and cut up with them. Because I made up my mind. I was not going to give in to the deep, dark depression that I knew could come if I
Yes.
had allowed myself to go there. Was it a struggle? Yes. Was there some days that I did give in to that? Yes. But that's when I had my husband, my mother, and my sister say, snap out of it. You get yourself together. You can have the pity party for a few minutes, but
I could totally see your mom doing that.
it's time now to get up and let's go again. And so, I needed that. I needed
Yeah.
the tough love.
Yeah.
Was it all sunshine and rainbows? No, it wasn't. But I knew I had to. I knew
Yeah.
I had to push forward.
Yeah. And I think that's so powerful that you talked about, mind over matter. And that, again, almost every show you hear me talk about just your mindset, that what we think, our mind and our thoughts are so powerful.
Yes.
If you're going into, like how Heather said, she's going into chemo, she's like, yeah, this is my time. It's going to be positive versus like, oh, I'm going to have chemo again. I'm going to get nauseated. I might vomit. I'm not going to feel well for a few days after my treatment, so if you're looking at it in that negative way, it does change. I mean, people essentially, studies have shown, can like induce illness
Yes.
into themselves if mentally they think that they're ill or their child's ill or something. I mean, it's almost like you conjure it up, you induce it. But the Bible says, for God has not given us a spirit of fear, but of power, of love, and a sound mind. And I just feel like that speaks about your whole journey, that
Yeah.
through it, I'm sure at times you were afraid, you were anxious. But I know, just hearing you talk, that obviously you leaned on God's word, your family was supportive. And I think it's important to remember, one, God's promises, and to remember who we are, who God created us to be. So I love that. So before the next question, I just did want to briefly just talk about, Heather talked about her biopsy, and how she got that. So if they do find a mass, they usually biopsy it to find out, again, to stage it. And that helps them to figure out how to treat it. And she talked about the type of cancer she had. So some cancers are hormone dependent, where they love hormones. That's why, for example, if you're on birth control, any sort of birth control or hormone replacement for any reason, you'll hear your doctor say, we don't want to do it for a super prolonged period of time because it can increase your risk of cancers such as breast cancer, uterine cancer, because those areas hormones go to. So I know she talked about those terms. So that's just kind of to give you give you an idea of what that is about. So I know you talked about your support system. So I want to give you an opportunity that you can shout out to. You can shout out more than 2 people who you just want to give some kudos to, that they supported you in such a fantastic way during your journey.
There is so many people.
I'm sure.
So many people. Of course, my husband. Of course, my husband. Fantastic. You know, have to get the girls up, get them dressed, go to school. My husband, my mother, and my sister. They would come and clean my house, and they would take care of the girls at school, and just, you know, they had my mother and my sister, my niece, my precious at the time 15-year-old niece. While I was laying in the bed, she would send me songs, praise and worship songs. She would send me scripture at the perfect moment. I know it was God using her. My in-laws, my work family, my church family, you, just, I can't pinpoint just 1 or 2 people, but
that's all right. That's all right. I think it's so special that you had so many people to support you. And I just want to encourage you, again, if you're listening, and if you, whether it's cancer or whether just anything else you're going through, don't isolate yourself, because isolation, again, just like Heather mentioned, the days that she didn't feel well, that was when her mind went to negative places. So don't isolate yourself. Keep yourself. And the other important thing is the people who you're around, make sure they're positive people, make sure they're supportive people, that they're not people who are going to bring you down. So I feel that's so important.
Yes, most definitely.
And I know, Heather, you're busy between your family, your job. Do you have anything coming up in 2021? Anything fun? Since now you're like, yeah, let's do it. Seize the day.
Well, my girls have been asking to go back to Disney.
Oh.
And so we are hopefully going to plan a big family trip, and just go and just live in the moment. And wherever, if it's the beach or if it's Disney or if it's the mountains, or, you know, I'm now ready to just go. Let's just go travel somewhere.
I know. I tell you what, next year, a lot of people are going to be at Disney because one, you know, the babies are turning 5 at the end of this year. And since they were turning 5, I'm like, let's just go to Disney. And, you know, it'll be like a quaint family fun. You know, they're not in real school yet, so it doesn't matter if they miss time. And then, you know, of course, we have COVID. And I've just heard so many people say we were supposed to go to Disney this year. So I keep saying next year they're going to be like busting at the seams because everybody will be trying to get in there next year. Well, that's awesome. Disney World is a lot of fun for everybody. It doesn't matter how old you are. Disney World is so much fun.
Yes.
Well, again, thank you, Heather. Any last words for our audience today?
Do your mammograms, do your self-exams, even though, you know, do as I say, I guess was the old terminology, but just take care of yourself, love yourself, surround yourself with positive people. And if you find something, go get it looked at. Don't put it off. If that thought keeps coming to my mind all the time, what if I had blown it off?
Yeah.
What if I had ignored it and didn't go get it looked at, and it was already stage 3? My children are now 8 and 5, and I'm blessed to still be here. I thank God every day that I'm cancer free, and that I'm still here to be their mama. And just, you know, I enjoy the little things, the simple things in life. So take care of yourself. You know your body. Get you a good doctor.
Those are all good words. But yes, take care of yourself. Don't ignore something.
No.
If it's not abnormal. I know a lot of people wait because you're scared. I mean, a lot of people wait because just out of fear of what it could be. But yes, just like you said, if you waited, you don't know how extensive it would have been at that point. Well, Heather, I just want, you know, if anybody in the audience wants to connect to you, whether, you know, they're getting ready to get a mammogram, if they just got diagnosed with breast cancer, if they're also a breast cancer survivor, I'm sure Heather I know Heather would mind to like chat with you or to connect with you, how can they connect with you?
You can reach out to me on Facebook. It's Heather Akins Overstreet, or you can email me at heatheraoverstreet@yahoo.com. And I would love to talk with you, encourage you, pray with you, cry with you, however you need.
Yes, so definitely connect with her. That's her email address. And then I'll have that posted up for our podcast viewers so you can see that, so you connect with Heather. She's such an awesome person. Thank you again, Heather. It has been my pleasure to have you on the Dr. Mom Show, and thank you so much for taking time out to share your story with us.
Thank you so much. I'm just blessed to be asked to be a guest and to be here to be a guest. So thank you.
Thank you. And of course, thank you everybody for joining us today. Don't forget to subscribe and leave a review on the show at Apple Podcasts. Don't forget also, we have the book Who Will Love Me from our previous guest, Miss Kayleen Marshall. If you have a family member with special needs, you can win a free book if you leave a review. Remember, I said a good review because your mama told you if you don't have anything nice to say, don't say it at all. Also, follow me on Instagram at drmom_show, or if you're a Facebook fanatic, you can find my page at the Dr. Mom Show. Also, if you prefer to check out videos, you can always get the show on YouTube or Facebook Live, and subscribe to the Dr. Mom Show on YouTube. And you check out everything that's going on at my website, drdaleemushalak.com. And of course, if you have a story, I would love to hear your story. I would love you to be a guest on the show. And of course, if you're writing a story and wanting to share your story that can make an impact, and you would love to turn your vision into legacy, you can always connect with me in regards to Alea Publishing, so we can help you get your story out there. And finally, my female Facebook group, Fearless, Flourishing, and Fulfilled Females. You can join that group on Facebook. Every week I have a challenge, there's recipes, and of course, daily encouragement. And don't forget, like Heather said, get your mammogram and make sure you talk to your doctor. Make sure you talk about any risk factors, like we talked about family history, even your diet, things like that, to have your doctor help you decide when's the best time to start your screening. And like I said, do what's best for your breast.
Yeah.
On today's show. So of course, remember, life is precious and priceless. You are amazing, and you can do anything you put your mind to do, because you are a superhero. Just have faith over fear. Don't forget to wash your hands, kiss your kids, love your family, and say your prayers. Good night. God bless. Love you guys. Bye.